Welcome to another deep dive. This time, we're going exploring the world of hospitals, specifically in India.
Okay.
We'll be using excerpts from Principles of Hospital Administration and Planning.
Yeah.
And hopefully this will give you, like a better understanding of how hospitals work within the Indian healthcare system.
Yeah, it's in an interesting topic for sure. I think,
Uh-huh.
we often think of hospitals as just kind of places you go when you're sick.
Right.
But there's so much more to it than that when you really start digging in.
Yeah, absolutely. So let's dive right in. The book starts off with the World Health Organization's definition of a hospital.
Mm-hmm.
And, it's not just about treating illnesses, it's about complete healthcare. And that includes preventative measures,
Right.
reaching out to families, training healthcare professionals, and research.
It's like a mini city almost.
Yeah. Yeah, it's like a little city dedicated to health, right?
Yeah.
And the textbook even poses this kind of provocative question,
Yeah.
almost challenging us, the readers, Cynics might say anything done in the name of healthcare will be successful most of the time because most patients get well anyway. So what difference does a hospital make?
Mm.
It really kind of makes you think.
It does. It does make you think.
Has your experience with hospitals been about more than just treatment? Have you ever felt that broader impact?
Yeah, for sure. I think about, like early diagnosis, for instance.
Right.
Hospitals, with all their specialized equipment and expertise, can detect illnesses at an early stage.
Mm.
And that can make a huge difference.
Yeah.
Think about it. A simple blood test, that can reveal a hidden condition
Right.
that, if left untreated,
Yeah.
it could have really serious consequences.
Yeah. That's a great point. It's easy to overlook the preventative role that hospitals play.
Right.
But to really understand the complexities of the present, maybe we should take a quick trip back in time.
Yeah. Yeah, I think looking back historically is really fascinating here. Did you know that ancient Indian rulers actually considered providing health care like a spiritual duty?
Oh, wow.
Yeah, you see this influence from figures like Buddha and Ashoka,
Right.
promoting compassion and care for the sick.
Yeah. And the book talks about these incredible figures, Sushruta, the surgeon, and Charaka, the physician.
Right.
And their writings, especially the Charaka Samhita, give incredibly detailed instructions on how to build hospitals.
That's amazing.
Specialized rooms, sterilization techniques. They even mention using steam.
Wow.
It's amazing to think about that level of sophistication so long ago.
Yeah, it is. It is.
But here's where it gets interesting. Fast forward to India's independence in 1947. And despite this rich history, the healthcare system was facing a very different reality.
Right.
Imagine a country with very few hospital beds, a serious shortage of doctors.
Yeah, that's a tough situation.
So how did they tackle this massive problem?
Well, they formed the Poor Committee to come up with solutions. However, putting those recommendations into action proved to be incredibly slow.
Oh.
Really slow. So it wasn't until 1959, with the formation of the New Delhi Air Committee, that things really shifted.
Okay.
And instead of, trying to make sweeping changes, they focused on strengthening the existing infrastructure.
So more of a practical approach.
Exactly. More practical, pragmatic.
Okay. So what's the current landscape look like now?
Well, according to the text, today India has over 15,000 hospitals. So the bed-to-population ratio has gotten better, but it's still around 0.84 per thousand people. And the doctor-to-population ratio, that's even lower, like one doctor for every 1,985 people.
Wow, those are some stark figures. Does that highlight the disparity between, say, urban and rural healthcare access?
Absolutely. It's a huge challenge. You've got technological advancements, a growing population, rising healthcare costs.
Right.
And then we've also seen the surge in private for-profit hospitals.
Right.
So yeah, it adds another layer of complexity.
Makes you wonder how hospitals can really balance their role as specialized treatment centers with addressing those broader health needs of their communities, especially in those underserved areas we were just talking about.
Right. It's a really good question, and it's one that I think we should dive deeper into. The book goes into more detail about primary health care.
Okay.
And the hospital's role in all of that.
Yeah, let's get into that. It seems like hospitals need to be more than just reactive treatment centers.
Right.
How can they actively engage in this primary healthcare? What does that even look like?
Well, imagine instead of waiting for people to get sick,
Right.
Hospitals become centers for community outreach.
Okay.
They run prevention programs, health education workshops, and actively try to reach those underserved areas we talked about.
So it's about shifting the focus from just treating illness to actually preventing it in the first place.
Exactly. And this shift can have huge benefits,
Yeah.
not just for individuals, but for the entire healthcare system. I mean, early diagnosis, as we talked about, leads to better outcomes.
Yeah.
Preventative measures can help reduce that reliance on costly hospital-based care.
Yeah, it's really intriguing. I'm starting to see how this seemingly simple shift in approach could have, like a huge ripple effect.
Yeah. Very
But
thought-
wouldn't planning for all of this be like a logistical nightmare?
Yeah, it's definitely challenging. You have to balance technical needs,
Yeah.
specialized equipment, facilities, patient comfort,
Right.
community demands, and of course, budget constraints.
Right. The book mentions something called floor area ratio. Can you explain that?
Sure, yeah. So floor area ratio, basically it dictates how much space a hospital can actually take up on its plot of land.
Okay.
And this is especially important in, densely populated urban areas.
Yeah.
So it's a practical consideration that can really impact the design and layout of a hospital.
That's fascinating. It makes you realize that even, like seemingly mundane things like the size and layout of a building can have a huge impact on how effectively it functions.
Yeah, absolutely.
And then there are also those absolute essentials that we, sometimes take for granted.
Yeah.
Things like reliable power supply, proper sewage disposal.
Yeah, it's easy to forget about those.
Right. The book really, really highlights those behind-the-scenes aspects. I mean, can you imagine, like, a hospital running out of power during a surgery?
Oh, that'd be terrible.
Right. The consequences could be devastating.
Yeah.
So it just highlights how those often overlooked elements of a hospital are just as critical as the medical care itself. Everything has to work together.
Right. It all has to be in sync.
Speaking of things working in sync,
Yeah.
the book also mentions this concept of regionalization.
Oh, yeah. Regionalization.
So it's the idea that hospitals should be viewed as part of a larger system, not just isolated units.
Right, right.
So it makes me think, could better cooperation between hospitals actually lead to like a more efficient and effective healthcare system as a whole?
Yeah, it's an interesting idea. It would definitely benefit everyone, right?
Right.
Yeah.
I think it's a question worth exploring. And it leads us nicely into a closer look at some of the specific departments within a hospital.
Yeah, let's do that.
Where should we start?
Well, let's start with the outpatient department, often just called OPD.
Okay.
And this is really where a lot of patients have their first interaction with the hospital.
Right.
So you can think of it as kind of the front door.
Okay. So the OPD is like the front door to the hospital.
Exactly. And managing that front door effectively is crucial.
Right.
I mean, think about the challenges they face. You've got to manage the flow of patients. You want to minimize those wait times.
Yeah.
And just make sure everything runs smoothly. The book uses this term holding capacity to describe how many people the OPD can comfortably hold at any given time.
Yeah, that makes sense. It's almost like air traffic control for patients.
Yeah, yeah.
That's a great way to put it.
It's about getting people where they need to be efficiently but safely as well.
Yeah, exactly.
Now from the OPD, let's move to the wards.
Okay.
Where patients are admitted for more long-term care.
Mm-hmm.
I find it fascinating that the design of hospital wards has evolved so much over time.
Oh, yeah.
The book talks about how we've moved away from the old Nightingale wards, those long open rooms,
Right.
to more modern layouts like the Riggs pattern.
Yeah.
It's a trade-off, isn't it?
Mhm.
The Nightingale wards, they allowed nurses to easily observe all the patients,
Right.
but they offered very little privacy.
Yeah.
So the Riggs pattern, it prioritizes, patient comfort and privacy while still allowing for efficient care.
Right, right. It's amazing to see how something as simple as the layout of a room can impact the patient experience.
Absolutely. And speaking of these specialized environments, we can't forget about the intensive care unit.
Right.
Or the ICU.
Yeah.
This is where the most critically ill patients are receiving that round-the-clock care.
Yeah, the ICU always seems so high tech and intense. What are some of the key challenges that they face?
Well, I mean, one of the biggest is staffing.
Mhm.
The ICU needs highly skilled nurses and doctors
Right.
who can, handle these really complex situations. The book also mentions this interesting thing called the power column. And
Okay.
it's basically this integrated hub that's found at each ICU bed. And it houses, all the medical gases and equipment they need. And
Wow.
it's really specialized.
Yeah, it sounds like every detail is carefully planned to ensure that patients in the ICU are getting the most advanced and comprehensive care possible.
Exactly.
Mm.
And it just highlights how those physical spaces within a hospital are designed to support those specific needs of
Yeah.
the patients they serve.
Yeah, definitely. So we've talked a lot about the physical spaces, the specialized departments.
Right.
But what about the people?
Yeah.
The ones who make it all work, like the heartbeat of the hospital.
Yeah, the human element.
Yeah.
Yeah, you can't forget that.
Yeah.
And I think, in that realm, the book really emphasizes the role of nurses
Right.
in patient care.
Yeah, they're often the unsung heroes,
Right.
always there on the front lines,
Yeah, for sure.
providing, care and comfort.
Absolutely. And the book actually highlights some statistics about that
Oh.
that really kind of underscore their importance. Did you know that nurses make up the largest single group of healthcare professionals
Mm.
in a hospital, larger even than doctors?
Wow, I didn't realize the gap was that significant. But it makes sense when you think about the sheer amount of direct patient care they provide.
Yeah, absolutely. And the book talks about this concept called progressive patient care,
Okay.
which I find fascinating. It's basically about, tailoring the intensity of that nursing care to the specific needs of each patient.
Okay.
So, someone recovering from surgery is going to need a different level of attention
Right.
than someone in a critical condition.
Yeah, that seems logical. You wouldn't want to spread resources too thin, where they're most needed.
Exactly.
But it also brings up the importance of training and,
Mhm.
and ongoing professional development
Absolutely.
for all hospital staff.
Right. Yeah, for sure. I mean, the medical field is constantly changing, new technologies,
Right.
new treatments emerging all the time.
So it's really essential for everyone involved.
Yeah, it's about making sure everyone has that knowledge, the skills they need to provide the best possible care.
Right. It's like a giant intricate machine
Mm-hmm.
where every cog needs to be, well maintained and functioning smoothly.
Yeah. I like that analogy.
But we can't forget about the fuel that keeps that machine running.
Right.
What about the financial side of things?
Yeah. The often dreaded topic of hospital finances.
Yeah.
But it's essential to understand, how these institutions stay afloat.
Yeah, I'll admit it's not the most glamorous aspect of hospitals.
Right.
But I'm ready to dive in. What are some key takeaways from the book on that?
Well, I think one of the first things it emphasizes is that it's not as simple as just profit versus nonprofit.
Okay.
There's actually a spectrum within both categories.
That's interesting. Can you elaborate on that a little bit?
Yeah. So the book explains that some for-profit hospitals might prioritize providing a comfortable and attractive workplace for doctors to practice,
Okay.
while, some nonprofit hospitals aim for a surplus
Right.
to reinvest in future growth.
So the lines can get a little blurry.
Yeah, they definitely can.
Okay. So regardless of profit status, hospitals need to have effective financial management strategies in place.
Absolutely. And the book outlines several key concepts that are essential to understanding this.
Okay.
For example, it distinguishes between revenue expenditure, which, covers those day-to-day running costs like salaries,
Right.
supplies,
Yeah.
and then standard costs, which is it's basically a predetermined estimate of what a particular service or item should cost.
Okay. That makes sense.
Yeah.
But hospitals are complex.
Right.
You've got so many different departments, services.
Right.
How do you even begin to track all those costs and revenues?
Yeah. Well, the book talks about this idea of revenue centers and cost centers.
Okay.
So revenue centers are those units within a hospital that directly generate income.
Oh.
So think like the OPD,
Right.
the surgical department.
Okay. And then cost centers would be those support services
Right.
that don't, directly bring in money,
Mm.
but are essential for the hospital to function. So like laundry,
Yeah,
the CSSD we talked about earlier.
exactly. And the book goes into this concept of cost allocation,
Okay.
which is basically figuring out how to distribute those indirect costs.
Right.
from the support services to the revenue-generating departments they support. It gets pretty intricate.
It sounds like a massive accounting puzzle.
It kind of is.
But I guess it's necessary to understand, the true cost of providing different services.
Oh yeah, absolutely. And this brings us to another essential part of that financial management.
Okay.
Budgeting.
Budgeting. I have to admit, it's not my favorite topic.
Yeah.
But I understand it's important.
It is. It's crucial for hospitals to plan for the future and allocate resources effectively. And the book highlights three main types of budgets.
Okay.
So you have the operating budget,
Okay.
the capital budget,
Mm-hmm.
and the cash budget.
So the operating budget that covers those day-to-day costs, like we talked about.
Right.
What about the other two?
So the capital budget, that's focused on big ticket items,
Yeah.
like new equipment or building expansions.
Okay.
So those are, decisions that require that careful long-term planning.
Right.
And the cash budget, that's all about making sure that the hospital has enough liquid assets
Okay.
on hand to meet their financial obligations.
So it's like a delicate balancing act.
It is. It definitely is. And it becomes even more challenging when you factor in the constantly rising costs.
Right. I mean, inflation affects everyone,
Yeah.
including hospitals.
Absolutely.
Yeah.
But what are some of those other factors that are driving up costs in the healthcare sector?
Yeah.
Well, the book mentions, the changing nature of the services themselves.
Right.
So we're seeing more diagnostic tests being ordered.
Mhm.
Treatments are becoming more and more complex.
Right.
There's this higher demand for cutting-edge technologies.
Yeah.
So all these advancements, while they are beneficial, they come at a cost.
Yeah. And I imagine patient expectations also play a role.
Yeah.
People are more informed than ever before.
Absolutely. They want the best possible care.
Yeah.
And this all adds up to a growing gap between what hospitals are spending
Yeah.
on providing care and what they receive in payments,
Makes sense.
especially those that rely heavily on government funding or serve a large population of low-income patients.
So it sounds like it's a constant struggle to stay financially viable,
Yeah.
then to provide that high quality care.
It is. It is. And that's why the book dedicates a whole section to cost containment strategies.
Okay. Let's talk about cost containment. What are some of those specific approaches that hospitals can take, to manage their expenses?
Well, I mean, one strategy is to focus on reducing the length of those hospital stays.
Okay.
So this could involve things like pre-admission testing
Okay.
to streamline the admission process, encouraging same-day surgeries
Right.
when possible, and then really implementing good discharge planning to ensure a smooth transition.
So it's about getting patients the care they need
Yeah.
as efficiently as possible without sacrificing quality.
Exactly.
Yeah.
Another approach is to really carefully evaluate, the need for certain tests and procedures.
Okay.
Are there any that could be, eliminated or replaced with less costly alternatives?
Yeah.
The book also emphasizes the importance of preventative measures,
Right.
to keep people healthy and out of the hospital altogether.
It seems like a lot of this comes down to good communication and collaboration between, doctors, nurses, administrators.
Yeah.
Everyone needs to be on the same page.
Yeah, for sure.
When it comes to providing this cost-effective care.
You're absolutely right.
Yeah.
And speaking of collaboration, the book mentions this concept called cost-effectiveness analysis.
Okay. What exactly is that?
So it's a systematic way of comparing the costs and benefits of different treatment options.
Okay.
So it's about helping hospitals make those informed decisions
Right.
about, which interventions offer the best value
Right.
for the money. And it's not always about choosing the cheapest option,
Right.
but the one that delivers the greatest benefit.
It's about finding that sweet spot between quality of care and responsible resource allocation.
Exactly. And this cost-conscious mindset is especially important in the context of, these emerging technologies,
Right.
which can be very expensive to adopt.
Yeah, hospitals can't just jump on the bandwagon of every shiny new gadget that comes along. Right.
They really need to carefully evaluate whether those potential benefits, justify the costs.
Absolutely. Be strategic
Right.
and selective.
So we've talked about the overall financial picture, the need for cost containment.
Yeah.
Now, are there any specific departments that the book highlights in terms of of their financial impact.
Yeah, there are a few. Radiology is one that comes to mind.
Radiology, yeah. I tend to think of, X-rays,
Yeah.
but I know it's become much more sophisticated than that.
Oh, yeah, absolutely. I mean, the field of radiology has really exploded in recent decades.
Right.
With advanced imaging techniques like sonography,
Yeah.
CT scans, MRI, and digital subtraction angiography.
Yeah.
So, all of these technologies, while they're incredibly valuable,
Right.
for diagnosis and treatment planning,
Mhm.
they require that specialized equipment,
Yeah.
highly trained personnel, and that can be costly. Yeah, and I imagine those costs are amplified by the fact that radiology services are in such high demand these
Oh,
days.
absolutely.
Yeah.
And the book even goes into, the specifics of the space requirements
Okay.
for different size hospitals. So, it's not just about having the technology.
Right.
It's about having the infrastructure to support it.
Yeah. That makes sense. Now, what about the lab? It's another department that's just, essential
Yeah, the lab is crucial.
for diagnosis and treatment.
They're responsible for, analyzing the blood work, tissue samples, all sorts of specimens. And the book actually breaks down the lab into several different functional divisions.
Okay.
So you have hematology, microbiology, clinical chemistry, histopathology, and then urine and stool analysis.
Wow.
So it's really a multifaceted department.
Yeah, it sounds like a beehive of activity.
It is.
But accuracy is paramount in the lab, right?
Okay.
I mean, a misdiagnosis could have serious consequences.
Absolutely. The book really stresses the importance of those quality control measures
Mm-hmm.
to ensure accurate and reliable test results. It's not just about speed, it's about getting it right.
Right. From analyzing blood to capturing images, it's amazing how much goes on behind the scenes to help diagnose and treat patients.
Yeah, it's pretty remarkable.
What about the operating rooms? That's where the most, critical procedures
Hmm.
take place.
Ah, yeah, the OR.
Hmm.
It's definitely a high pressure environment,
Yeah.
demanding that meticulous attention to detail,
Right.
precision, teamwork.
Right.
And the book delves into, the specifics of OR design and layout,
Okay.
really emphasizing features that promote a sterile environment.
Yeah, I bet infection control is a top priority in the OR.
Well, absolutely.
Yeah.
The book talks about, smooth traffic flow to minimize contamination,
Right.
easy to clean surfaces, proper ventilation,
Mhm.
to maintain that sterile environment. They even get into the ideal color schemes
Oh, wow.
for the walls, floors, and ceilings.
Interesting.
Light colors are generally preferred because they reflect light
Yeah.
and create a more calming atmosphere.
I never would have thought about that.
Yeah.
But it makes sense, Every detail matters
Right.
when it comes to surgery.
Absolutely. And speaking of detail, we can't forget about the recovery room
Right.
where patients are monitored after their procedures.
Mm-hmm.
And the book outlines, some key considerations for this space as well.
Mm.
Ensuring adequate staffing,
Right.
having all the necessary equipment readily available,
Mm-hmm.
and just creating a peaceful environment for patients
Yeah.
to wake up in.
It's like each space within a hospital
Hmm.
is carefully designed
Yeah.
to support a specific stage of the patient journey.
Absolutely. It really highlights the level of planning and coordination
Yeah.
that goes into providing that comprehensive care.
Speaking of crucial departments, what about the pharmacy?
Oh, yeah.
They play a vital role in ensuring that patients receive the right medications.
They do. The pharmacy is essential.
Yeah.
And the book talks about the importance of having a well-stocked pharmacy,
Right.
with proper storage and handling procedures for medication.
Right.
And then, of course, a system for accurately dispensing those medications.
I imagine there's a lot of regulations and
Yeah.
safety protocols involved in managing all those medications.
Oh, absolutely. The book even mentions this thing called a hospital formulary,
Okay.
which is basically a list of approved medications that can be used.
Oh, that's interesting. That makes sense. It probably helps to standardize treatments.
Yeah.
Make sure everyone's on the same page
Hmm.
when it comes to prescribing and dispensing medication.
Absolutely. And it helps to streamline that process.
Right.
And potentially reduce costs as well.
Yeah. So we've touched on the unique aspects of several key departments,
Mhm.
but let's zoom out for a moment. What does the book say about the overall management of a hospital? What are some of those key principles of hospital administration?
Well, I think one of the first things it emphasizes is strong leadership,
Yeah.
which might seem obvious,
Right.
but a hospital is a complex organization
Right.
with so many moving parts,
Right.
different departments, stakeholders.
Yeah.
You need someone at the helm to guide the ship effectively.
And I imagine that's a role that requires a pretty diverse skill set.
Oh, absolutely.
Yeah.
The book describes the many roles and functions of a hospital administrator,
Okay.
and they need to have a strong understanding of financial management, be able to oversee those daily operations,
Right.
handle personnel issues effectively, and even cultivate a positive public image
Yeah.
for the hospital.
It sounds like a demanding
It is.
but incredibly rewarding job.
Yeah.
It's kind of like conducting an orchestra,
Mhm.
making sure all the different sections are working together harmoniously.
Yeah, that's a great analogy.
Yeah.
But even with the best conductor in the world, you need a skilled orchestra
Right.
to produce that beautiful music.
Right. So in hospital, that means having a well-trained and motivated staff.
Exactly.
The book talks a lot about the challenges of staffing, doesn't it?
It does. Finding and retaining those qualified personnel
Mm-hmm.
is a major concern for hospitals,
Mm.
especially in areas where there's a shortage of healthcare professionals.
Yeah, I imagine things like, competitive salaries, benefits packages,
Mm.
opportunities for professional development, all play a role in attracting and retaining talent.
They absolutely do.
Yeah.
The book also stresses the importance of that ongoing training and education
Right.
to keep staff up to date
Yeah.
on the latest advancements.
So it's not just about filling positions. It's about creating a work environment where people feel, valued and supported and
Yeah.
and empowered to grow.
Exactly. And that brings us to another crucial aspect of hospital administration
Hmm.
that the book highlights.
Okay.
Communication.
Communicate. I mean, that's important in any organization.
It is, but it's absolutely vital
Right.
in a hospital setting. The book really stresses the need for clear, accurate, and timely communication
Right.
between departments,
Right.
between staff members, and between the hospital and their patients.
Yeah, I can see how effective communication could really, prevent misunderstandings,
Yeah.
reduce the risk of errors,
Wow.
and ultimately contribute to better patient care.
Absolutely. And clear communication also plays a key role in maintaining a positive public image
Right.
for the hospital,
Yeah.
which is becoming increasingly important in today's world.
That makes sense. What does the book have to say about public relations?
Well, it highlights the importance of, managing that relationship with the community, the media, the public.
Right.
So it's about building trust,
Yeah.
promoting transparency,
Mm.
showcasing the hospital's dedication to providing that high-quality care.
I bet that's especially challenging in the age of social media where information spreads so quickly.
It is. Hospitals need to be proactive
Yeah.
in managing their online reputation,
Right.
engaging with the public authentically.
Right. So it's not just about putting out glossy brochures and press releases anymore.
Oh,
It's about having those real conversations
Mhm.
and building genuine relationships
yeah,
with the community.
exactly. And those relationships are built on trust, transparency,
Right.
and a genuine commitment to serving the community's needs.
Yeah. We've covered a lot of ground.
Yeah.
From the history of hospitals in India
Wow.
to their financial structures, the role of leadership,
Yeah.
communication. But as we kind of wrap up this deep dive,
Right.
I'm curious about those often overlooked aspects of hospital administration.
Mhm.
What are some of those unsung heroes that keep things
Right.
running behind the scenes?
Yeah, there are a lot of those behind the scenes operations
Yeah.
that are really essential
Right.
to a hospital's success.
Mhm.
And one that the book really highlights is linen and laundry services.
Laundry, honestly, that doesn't sound particularly exciting.
I know, right?
But I'm willing to be convinced.
Hmm.
Why is laundry such a big deal?
Well, think about it.
I like that.
Every patient, every procedure requires clean linens, sheets, gowns, towels, surgical drapes.
It all adds
It
up.
adds up, yeah.
Yeah.
It's a massive amount of laundry.
Right.
And if the laundry service isn't functioning properly,
Right.
it can really impact the entire hospital.
Yeah, I'm starting to see how a linen shortage could be a problem.
Yeah.
But is it really that complicated? It's just
Right.
wash, dry, fold, repeat.
Well, it's actually a lot more intricate than you might think.
Okay.
The book goes into detail about the different stages of the laundry process,
Right.
from sorting and washing to drying, ironing, and even mending.
Wow.
And they really emphasize the importance of proper ventilation,
Okay.
temperature control to prevent the spread of bacteria
Ah.
and just ensure that everything is properly sanitized.
So it's not just about cleanliness,
Uh-uh.
it's about infection control as well.
Yeah, absolutely.
Yeah, that makes sense.
Hmm.
Now on a slightly less appealing note,
Okay.
what about waste management? I know it's a necessary evil,
It is.
but I'd rather not dwell on it too much.
Yeah, I hear you.
But I mean it's a critical part of maintaining a safe and healthy environment
Absolutely.
in a hospital, right?
Yeah, for sure.
And it's more complex than you might imagine.
Right.
Did you know that hospitals generate a wide variety of waste,
You?
from general trash to hazardous materials like needles and contaminated dressings?
It's a lot to deal with.
I guess I never really thought about it, but that makes sense.
Yeah.
So how do they handle all of that?
Well, the book stresses the importance of having a clear waste management policy
Right.
in place with designated areas for collecting and sorting
Okay.
different types of waste.
Yeah.
They even talk about color-coded containers
Oh, wow.
to help staff easily distinguish between general waste,
Right.
recyclable materials,
Okay.
and hazardous waste.
So it sounds like a pretty well-organized system.
Yeah, it is. It's pretty impressive.
So what happens to the waste once it's sorted?
Um, well, the book discusses various methods of disposal,
Okay.
including incineration, autoclaving, and even microwaving.
Microwaving waste. I've never heard of that.
Yeah, it's becoming more common.
Really?
Yeah,
It's-
as a way to sterilize
Wow.
certain types of medical waste.
Okay.
But regardless of the method,
Right.
the key is to ensure that it's handled and disposed of in a way that minimizes risk
Yeah.
to human health and the environment.
Right. It's amazing how much we take these behind the scenes operations for granted.
It is.
But they're truly essential for keeping a hospital running smoothly and safely.
Yeah, absolutely.
No, on a more serious note,
Okay.
what about the legal considerations
Yeah.
surrounding hospital administration?
Yeah, that's a whole other area.
Those must be pretty significant.
Oh, yeah, absolutely. Hospitals operate within a very complex legal framework.
Right.
And the book provides a good overview of some key areas to be aware of.
Okay.
Um,
Well, I know patient confidentiality
Yeah.
is a huge
Wait,
role.
it is. It is. Protecting patient privacy is paramount.
Right.
And the book goes into detail about those laws and regulations
Yeah.
that govern the handling of medical records,
Right.
personal health information.
And what about medical negligence?
Right.
That must be a major concern for hospitals.
It is. And the book defines medical negligence as any act or omission
Okay.
by a healthcare professional
Yeah.
that deviates from the accepted standard of care
Right.
and results in harm to the patient.
So if a doctor makes a mistake,
Yeah.
that harms the patient, the hospital could be held liable.
It's possible.
Yes.
Yeah. The book explains this concept of vicarious liability,
Okay.
which basically means that hospitals can be held responsible
Oh.
for those negligent actions of their employees,
Right.
even if the hospital itself didn't directly do anything wrong.
That makes sense. It underscores the importance of having, those clear policies and
Mhm.
procedures in place,
Yeah,
providing that proper training and supervision for
Sure.
all staff.
for sure.
Right.
Yeah.
And the book even mentions the increasing importance of medical indemnity insurance
Right.
for hospitals and healthcare professionals to protect themselves from those financial repercussions of malpractice lawsuits.
It's a big issue.
Wow, it's a lot to think about.
It is.
It really highlights the complex and multifaceted nature of running a hospital.
Yeah, for sure. And while we've only just scratched the surface here,
Right.
I think it's clear that hospitals are so much more than just buildings
Yeah.
filled with medical equipment. They're
Yeah.
really intricate ecosystems that require a delicate balance of resources,
Right.
expertise, compassion, and a deep commitment to providing that best possible care.
Well said. It's been a fascinating journey exploring
Yeah,
principles of hospital administration and planning.
it's a great book.
A huge thank you to our expert for sharing their insights and guiding us through
Magdalene.
this complex world.
Happy to do it.
And to our listeners,
Yeah.
we hope this deep dive has given you a newfound appreciation for the intricate workings of hospitals,
Right.
especially within the unique context of the Indian healthcare system.
Yeah, for sure.
What surprised you the most? What aspects are you most curious about now? We'd love to hear your thoughts.
Yeah, let us know.
Thanks for joining us on the deep dive.